prefer to be referred to as Margaret? Okay, Margaret. My name's Gemma, and I'm part of the physiotherapy team that's going to be working alongside you to help you manage your COPD. You may remember me from the ward. We met when we did your initial assessment and we discussed the referral to the pulmonary rehab class. Okay. So I'm aware that you don't know that much about the class, but you're keen to give it a go. So the purpose of today is just to give you a background about the class, what it involves, and give you the opportunity to ask any questions that you may have. Does that sound okay? Great. Okay, Margaret. So you've been discharged now for a few days. So obviously we look to get you into the class as soon as possible. So before you start the class, you're going to come into the hospital, into this department here, and you're going to have a one-to-one session, and that'll be with either myself or one of the assistants. And in that time, what you're going to be doing is what we call outcome measures. So you'll be doing a few fitness tests. So you'll do these before you can start the exercise class, and then again at the end of the 6 weeks after completion of the programme, and that'll help us distinguish if you've made any progress. Okay. So the fitness tests involved are what we refer to as the 6-minute walk test. So it involves 2 cones that are 30 metres apart, and within 6 minutes it's just seeing how many times you can walk that distance. But there is a chair at either end to allow you to have a rest at any point. Okay. The next one we do is referred to as the beep test, which again is a walk-in measurement, and you're walking to and from each cone and you're trying to make the beep. And then we also will get you fill in some questionnaires that are in relation to the quality of life that you have and just how you feel your COPD affects your lifestyle in terms of limitations or restrictions it may have. So we'll not talk about that in too much detail because you will go through that when you come in for your one-to-one, and you will have the opportunity to do a practice run of each test so you're familiar with what you're doing. Okay. In terms of the exercise programme itself, it is 6 weeks and it will be 2 hours twice a week. Okay. So 1 hour is going to be education and the other is going to be exercise. So in relation to education, it's going to be a talk, and it's going to be led each week by a different healthcare professional from the team. So you will have a pharmacist who will talk to you about medication, inhalers, and answer any questions you have about what medication you're on and what it does. We'll have a respiratory nurse, again, who you can ask any questions about your condition to. We have a psychologist who will come in and talk to you just about managing with your condition, not just physically but all the other impacts that it can have on your emotions and how you feel about it. We will also have a dietitian coming in, and I am aware that you have been suffering with poor appetite lately and have been struggling to build that back up. So the dietitian will come in and talk to you about the importance of good nutrition and give you a bit of education and advice on that. And then of course there will be physio intervention, so we'll work to introduce techniques of chest clearance, which I'm sure you're already familiar with anyway because of your recent admissions to hospital with chest infections. You will have been doing things like active cycle breathing just to clear your chest, and we'll be reinforcing that technique, how to do that correctly, and doing that even when your chest is good, just to maintain it. Okay. In terms of the exercise programme, it's going to consist of 8 stations, each of which is 6 minutes long. It's going to be, before that you complete any of the exercise, you're going to be partake in a short warm-up, which will be led by the fitness instructor Carl, who works alongside me in running the class. And then you're going to complete your exercises, and that's going to be followed by a short cool down. Okay. In terms of the exercise we do, they aim to mimic activities that you'll be doing throughout daily living. So we have a step-up session, we have sit-to-stands, we have a exercise bike as well. We also have doing mini squats and the parallel bars, and we also have work that is exercise that are designed to work the upper body and get those muscles going. So we have what we call bicep curls. So the class is beneficial in terms that it's a mixture of endurance activities, so cardio based, which are getting the heart rate going, and also there is strengthening exercise for the upper limbs, so that you're building up those muscles to help you do things that you do throughout, daily life, lifting, reaching, things like that. Okay. Each station is entirely self-paced, so In the 6 minutes you can do as many repetitions as you feel, and you can take as many rests as you require. So whilst there's no set rest intervals built into the programme, you have the opportunity to rest at any point that you require. Okay, and we can't stress that enough, because whilst there is 8 other people in the class, it's entirely up to you how you pace each thing. And you'll have a sheet with you, which we'll go through again in your one-to-one, just show you the layout of it. But it has each station, and beside it has the number of repetitions you do within that time, and also a box to record the number of rests that you do within that time. And the overall aim is that you will improve the number of repetitions as the weeks go on, and hopefully reduce the number of rests as the weeks go on. Okay? And like I say, once you've completed the exercise class, you'll come back in and then we'll do your outcome measures and measure any progression. But the important thing about the class is that the fitness instructor Carl and myself will be on hand at all times throughout, should you need any advice, should you feel short of breath, anything. So the fears that you had expressed to me in the ward about the breathlessness on exertion, which you have mentioned a few times, you're completing the exercises in a safe environment where you have us for support should you need any. And we'll be monitoring you and keeping an eye on you, and everything is just what you can do at your own pace. And what's good about the class is the exercise we do are transferable, so there are things that you can go home and do by yourself. Obviously, until we build up your confidence with it and you feel a bit more happy to proceed with exercise. I know you are a bit anxious about it at present, but when you feel a bit better with exercise, you can start to do them at home, and it helps you to introduce this idea self-management, which is where you're taking on the role, you're doing these exercises that you've been set and you're feeling comfortable doing them, but also you have our support if you need it. So I am aware that when you were in the ward we did discuss transport with you, and we did. I just want to confirm that you don't require ambulance transport. Your husband Jim is okay to bring you to and from the class, okay? And the class is going to take part on a Monday morning 11 to 1 and a Thursday afternoon 1 to 3, and it'll be in the gym here at the hospital. Okay, so that's basically an overview of what the class is, what it involves. The main benefits is that you will see an increase in your exercise capacity, so that just means that activities that you're struggling with at the minute should become a wee bit easier, because we're just building up your tolerance. And basically the benefit of exercise is that at the minute whilst your body's having trouble using oxygen, the exercises improving the ability of the body to transport the oxygen and use it, and making it more efficient. And the reason we include resistance activities like this is because of the mechanisms that has been affected by the COPD, you can find that these shoulder muscles try and compensate, and they try to help the muscles that help you to breathe in and breathe out, and as a result they can become weaker because they're not doing the functional tasks that we would want them to. So the combination of endurance and combination of resistance is designed to improve your function as a whole. Okay? Okay. Does that sound okay? Did you have any questions or queries?
No, that's brilliant.
No. So we'll organise your appointment now for you to come in for your one-to-one before you leave, and should you have any questions or queries before then, just give us a call. I'm aware that we've thrown a lot of information at you today, so I've just got a sheet here with all the main things that you need to know, and frequently asked or concerns or questions that patients may have, so you can take that home and have a read up on it, okay?
Thank you.
Okay, Mark.